Many girls come to me with so many questions regarding breast implant. So I thought let's make a video and answer most of the questions. Hello, I'm Dr. Sheetal Londhe, a board certified plastic surgeon. I'm practicing at ZeroSize Women, Pune. The first question that comes is, ma'am, am I a right candidate for breast augmentation or a breast implant? When you come to my consultation, the first thing that we do is we will take some measurements. There'll be some body markings. We'll do some calculations that will be done. What is the size of your breast cup at present? How much breast tissue you have? And depending on that, we will give you an honest answer, yes, whether you need a breast implant or you don't need a breast implant. There are many things that the tissue is going to talk to us about regarding just not that whether it's a low volume or a high volume. There is something called as tissue laxity, breast sagging. There are breasts which are asymmetrical. So many things are there we have to look into before planning a breast implant surgery. Next question is, ma'am, is implant only the answer that I have? Okay, it depends upon your body frame. I work on things where, I want to give a natural curve to that body. So I prefer mostly doing a breast implant. But yes, fat grafting is also a very good option. If you have enough fat in your body from where I can harvest it and use it, we'll definitely have that option. Just not breast implant or fat grafting. Sometimes people even ask for non-surgical options. Depending upon that patient's age, the tissue nature, the requirement, we may decide on what other non-surgicals that we can offer you. If there's a sag, does that need a lift? If just a little volume loss, does it need few mm or some other product here and there? So that will be decided depending upon the patient. But still, I practice and I always advise to go for a surgical line of management for any breast contouring. Few will come to me and say, ma'am, okay, fine, I'll do a breast implant now, but I'm still not married. I'm going to get married. I'm going to have kids. Will I be able to breastfeed? Yes, definitely you will be able to breastfeed because these implants, they are sitting under the breast. So they are not at all disturbing any main anatomy of the breast regarding the milk ducts, the milk gland and everything. So breastfeeding is definitely possible after breast implants. I have had patients who have, breastfed two kids and then come to me regarding saying, yes, ma'am, we were really satisfied that we had implants and still we could enjoy our motherhood very nicely. Okay, so this is one other question answer. Then there are many who say, okay, I'll do a breast implant, but I don't want anyone to know that I have done a breast implant. If you're wearing a good cup size padded bra always, then yes, when we put a breast implant, maybe people will not notice. But definitely you should know that there's going to be some increase in the parameters of your body. So that is going to be noticeable. So breast implant is a very simple procedure. It's not necessary that you should disclose that, yes, I have done a breast implant surgery because you don't need to rest a lot on that. There are no much stitches over there. So like if you're having a major surgery of an hernia or some other like thing, people get to know about it because that sickness has been seen on your face. But in breast implant, it's the OPD procedure. You come, do and you go. It doesn't been seen by that, yes, you've undergone a procedure. Now, the next question is, what aftercare do I have to take? If I put in breast implant, will I have to stop swimming? I'm already doing regular gym and how do I do that? You do not have to stop all that. Yes, there is a brief period of time which we will tell you regarding what implant, what size I have put and what plane I have used. That yes, you need to stop your gymming for maybe a month, 6 weeks, 2 months, depending upon what plane I have put it. And then you can continue all your routine activities from swimming, gymming, dancing, everything. There are no restrictions per se for your physical activities after breast implant surgery. Now, what are the aftercares? Yes, there is aftercare after breast. There are some types of, special types of a compression garment or a bra that you need to wear. There are some types of massages which you have to follow, but that is only for a very small time, a month and a half max, and then you're back to your normal. There are girls who have forgotten that they have a breast implant inside, and for some other reason, they have to go for any sonography or x-ray. Then they give me a call, ma'am, I'm going for an x-ray. Do I need to tell them that I have an implant inside? Literally, girls forget that they have an implant. It becomes that much your part of your body. One more question, will it be detected in detectors when I'm going abroad or in the airplanes and all? If that was the reason, every third or fourth female would have got the beep of having the detector notice that there's a breast implant inside. So it is a silicone. It is not been noticed in any of the metal detectors or any detectors. But yes, if you're undergoing any treatment, a doctor has advised you for a sonography, for an x-ray, it is your duty to tell him that yes, I have a breast implant inside, so that the findings of the doctor to report those x-rays or the sonography is not hampered because of you're not disclosing to him that you have an implant. These are just a few questions which just came to my mind and I felt like answering them. If there are more questions you have and you want an answer for them, please visit us at ZeroSize Women, Pune.